Let's have a quick review on the hypothalamic pituitary gonadal axis. Hypothalamus secretes gonadotropin, releasing hormone which prompt production and secretion of LH and FSH from the endothelial pituitary gland, which stimulate the ovary to produce estrogen and progesterone. Disruption of any this communication result in alternation of hormone, which can lead to ovulation disorder. One example being PCOS. PCOS is one of the most causes of female infertility. In PCOS, ovary follicle grow but none are mature and some remain acid. The main etiology and endocrine aspect of PCOS are the increased level of androgen, which is also known as hyperandrogenemia, and secondly, this insulin resistant.
Studies have shown that in PCOS patients, brain does not produce GnRH in normal cycle. GnRH secretion is relatively fast, causes LH levels to rise and FSH levels drop. LH causes ovary to produce more androgen. Due to this overproduction, the ovarian follicles fail to mature, which can lead to anovulation or failure to ovulate. If there is no ovulation, there is no production of progesterone. In PCOS, they start making slightly more androgens. This causes patients to stop ovulating, get pimples, and grow extrafacial and body hair.
Insulin is a hormone produced by the pancreas and is necessary for consumption of blood glucose by body cells. Increased insulin level in PCOS patients is a result of the body compensatory response to insulin resistance associated with PCOS. The excess insulin, together with high levels of luteinizing hormone, induced and maintained overproduction of androgen by the ovaries. So the excess insulin in the body binds with LH in ovary, resulting in increased production of androgen.
In women with PCOS, the reason for infertility may be due to blockage from the fluid-filled sheath in the ovary, as well as imbalance in sex hormone. Consequently, it's common that a healthy mature egg won't form or be released from the ovaries.
Metformin is a type of drug used to inhibit the production of hepatic glucose, reduce intestine glucose absorption, and improve insulin productivity by manipulating the uptake and utilization of glucose by the body. As explained before, women with PCOS usually have insulin resistance. The insulin resistance usually leads to higher level of insulin inside the body, and that affects the ovary, which leads to high level of androgen that prevents the ovarian cycle to develop during ovulation, which leads to the accumulation of ovarian follicle that did not progress during the ovulation and leads to cyst production. Metformin, when consumed by the PCOS patients, can help with the issue regarding insulin resistance and help to promote ovulation.
Clomid is an oral medication used to treat infertility in women. It works by increasing the amount of FSH your brain produces to help mature your eggs into ovulation. Clomid blocks the brain's ability to sense your estrogen levels. In turn, your brain sends down larger amount of FSH to stimulate growth. This causes your follicles to continue to mature into ovulation.
Last treatment is in vitro fertilization, where sperm and egg are fertilized outside of the human body. First, we need to test and diagnose through medical history before treatment begins. Next is ovarian stimulation, where AMH was injected. Third, egg retrieval, where the needle is inserted in vagina to pull mature egg outside. Step 4 is sperm retrieval. Step 5 is fertilization. And lastly is embryos are injected into uterus.